Wow, I just can't stop grinning. The only thing that took the grin off my face was when I walked around earlier this morning and I had a tear in my eye walking around this building because it is truly spectacular and it's really special. And everybody that's spoken before me has thanked everyone and talked about the process, but until you've seen it from the beginning to the end, it is truly a staggering accomplishment for UW Health to have done this. People ask me why the American Center? Why do we have this hospital here? And that goes back a long time. The last time I was at one of these events was when we opened Research Park Sports Medicine Clinic. And at that time, we had some facilities for exercise, for seeing patients, for taking x-rays. Within a few years, we realized that we stopped way short of what we needed to do to really change healthcare. When we work at a large place like UW Hospital, there's many things that we do. We have multiple missions. When you work in an operating room, there's things like transplant surgery and trauma surgery that takes precedence over most everything else. And it became clear for the highly elective services like orthopedics or parts of general surgery that was not in the patient's best interest to have things constantly getting in the way of their planned surgery. So early on, maybe 10 years ago, Donna Sollenberger, the CEO at that time of the hospital, and I began talking about an orthopedic hospital. She eventually purchased this land, decided this would be the best place to put a hospital for the growing community of Sun Prairie, for the outreach that we do north, south, and east of Madison. David Entwistle and then Ron Slawinski got involved to make that idea a reality. And I think it was really Ron who brought the efficiency aspect to the healthcare. He engaged consultants that worked with the lean process. For those of you unfamiliar with lean, that's how Toyota designs factories to build cars to have the highest quality result. And it was really those consultants that's changed our way of thinking about how we deliver healthcare, because they brought us together to design a process of healthcare. Meaning we took every step that a patient sees from the moment they enter our building to the moment they leave, and we took every step to make it efficient, patient-friendly, involve the least number of people, repeat the least number of steps, and it really changed the process of how we deliver care. And it really wasn't until then we began designing the building. You know, most buildings are designed by architects. This building was designed with incredible architects, but also with nurses, nursing assistants, surgical scrubs, surgeons, hospitalists. The people who work here helped design this building with the architects from day one. And I think that is in itself a shocking development in how healthcare has changed. So we've become efficient in the process of delivering healthcare, but it's really about improving the excellence through those processes that we've achieved here. As Dr. Guerin just said, we do a lot more than take care of people that are injured or sick here. We have an entire wing of the building trying to improve the health of our patients before they ever need our services as healers. That includes changing how we eat, working on how large we are, preventing injuries, teaching our coaches how to coach youth sports better so they don't get injured in the first place. I think one of the biggest differences in how this building will run comes from the lean concept of the factory floor. So in the lean process, the factory floor is where all the work gets done. This is not a factory, but we do get work done here. And the key is that in the lean process, the leaders of the organization are on the factory floor to see how things work. And I think that's one of the main changes of this institution. When we ask what's new, Dr. Guerin's going to be working in the operating room. Dr. Ford is going to be giving anesthesia. We're going to have our leaders here working along with our patients so that we don't just start in an efficient manner, but we continue to evolve over the years to become more and more efficient, patient-centered, and achieve excellence. The spirit of cooperation that we have in this building is what will drive it towards excellence. I'm a firm believer that there has to be a balance in the academic missions of education and research and the clinical mission of delivering high-quality care. And it's really that high-quality care that drives the other missions. It's a circular argument. You can't educate well or do research well unless you're also turning that back into excellence in clinical care. In orthopedics, we do research. We have a foundation called the Freedom of Movement Fund that's helping to fund our research. As you walk through the building, you may see some plaques recognizing some of the donors to that research fund, and that helps complete the circle of research and clinical excellence. I do want to thank UW Health for its vision in allowing this innovative structure to be built. It's not easy to move a system to do something like this, but once it gets moving, the UW Health can build an incredible momentum that's resulting in what we see today. Frank Lloyd Wright, one of his favorite quotes was that form follows function. And yes, this is a beautiful building. As you walk around, your jaw may drop a few times. You may not have a grin like I have, but you might smile. But the key is that form follows the function, and this building will function now and in the future to really help improve the quality and the excellence of all the care that we deliver to you, our patients. So thank you.